I don't have specific numbers right now. I did reach out and talk to the family helpline yesterday. They're seeing pretty steady as what they have been seeing. The requests that they're getting are parents calling in asking for coping skills. You know, they're at home now with their kids, and maybe they're working from home and having to educate their kids. So it's not parents specifically looking for mental health services, but just how do I cope? How do I deal with this? But they are fully anticipating that once we get through this initial wave of the physical health emergency, that's when those mental health demands will kick in. I mentioned the rural response hotline. The numbers that they're seeing, the calls coming into that line have definitely picked up. They were already picking up ahead of COVID, and now since COVID, they are right up there with the numbers of calls that came in during the farm crisis of the 80s. I think there's some mixed numbers as far as some of the other hotlines like suicide. I'm not necessarily hearing any increase from suicide hotlines. Have you heard, Sherry? I've heard in some places domestic violence hotlines, some are picking up, some not. I know there was concerns having people confined together that they wouldn't be able to make those calls, the people that needed the services. So it's something that we're certainly going to try to stay on top of, talking to our providers, listening to what they're hearing from their people that they're serving to see if those needs are being met. But the demand is it already was picking up ahead of COVID, so COVID is just going to exacerbate that demand, especially once the initial emergency is over.